Good evening. I am Dr. Gages, and you are Kylan, right?
Yep, that's my name. It was hard to find this place, but I'm here.
Well, that's good. How's your day going?
Uh, Pretty well. I mean, we're having a party after this in my workplace.
That's good. So, what do you work as?
Oh, I'm a software engineer. I work at computers. It's really amazing to see in so short time, computer has advanced a lot.
Yeah, time does move pretty fast. So we're here to look at your medical file and see if there needs to be any actions that need to be done.
Okay. Something before that, is everything good here in this facility with the HIPAA rights? Because the other place was horrible with it.
Yeah, so we make sure we protect all our patients' privacies and keep it safe in your hands and our hands. So it says that you are experiencing chronic obstructive pulmonary disorder. Is that true?
Yeah, I've been experiencing for like a year, something like that. I would cough along with it.
All right. So do you know exactly what it's doing to you?
Oh yeah, my last doctor told me something about it. It was something. It obstructs my lung, my airway, or something like that.
Alright, and it says that on your medical file that you are taking, let's see, albuterol inhaler to combat this, right?
Oh yeah, exactly. It helps me breathe and wheeze better. Yeah.
Alright, and then have you been considering taking oxygen therapy or other medicines?
I haven't really thought about it. What does these medicines do actually?
Well, there are medications like steroids and bronchodilators and phosphodiesterase 4, which they all can like reduce the inflammation in your airways, and then you can like probably do some oxygen therapies too.
Okay, I may be getting a prescription after this.
All right, and your medical file says you are having an increase in weight and respiratory rate. Is that true?
Yeah, I think my COPG has become worse over the time.
All right, and so basically you're getting weight because your body's like you're not getting enough oxygen in, and you're getting like fatigued way too fast, preventing you from getting any physical activity in.
Okay.
All right, and let's see what else is on here. Medical file. You've been smoking for around 35 years. Is that right?
Oh yeah, but I stopped after getting diagnosed with COPD.
All right, and then do you have like a family history with medical?
Yeah, my family has a history with heart attacks. Actually, my dad has hypertension, so I think I got my hypertension from him.
Okay. And then looking for your lab results, it seems that you have abnormalities in blood counts, arterial blood gas, and cholesterols. Have you been aware of this?
Uh, I guess they told me something about this in my last checkups in my last facility, but they never went into it.
Alright, well, it seems that your hemoglobin levels are lower than normal than in your blood count. There's also a larger than normal biocarbon boron and partial pressure in your CO2 levels. Your cholesterol levels are all abnormal as your high density lipoprotein is too low. And your low density lipoprotein is too high, which is making your all your levels and totals like way too high. It's like higher than normal.
Is there anything I can do with those?
Well, we can probably just run another test and another appointment, which we can schedule at some point.
All right, when we should schedule.
Well, we'll have to figure out a date for that, but first we have to discuss your medical procedures and imaging results. It says you've been taking a spirometry test and you measured at least like 60% for force extraordinarily volume 1. So you basically have mild obstruction of this, and we can do like treatments on it like bronchodilators and oxygen therapies, and that's like it'll help you like get your breathing in easier, like open up your airways. And then for your imaging results, your lung x-rays, it seems that you have hyperinflation in your lungs. Is that true?
Uh, oh yeah, I remember getting those like a year ago.
So what this means is that your lungs is like uh, enlarged, and so like your oxygen is getting like stuck in, like air is getting trapped inside.
Has anyone found a way to cure this?
Yeah, there's many ways to treat this, as you can use like bronchodilators, oxygen therapy, and breathing exercises, and lung volume reduction therapies. Now that I've seen your Now that seems to be it for your medical file because it shows that your plan of care is empty. So I do have some recommendations for you.
What are those recommendations?
Well, I recommend that you change your routine to include breathing exercises and specialized breathing. And I would also suggest you help with taking bronchodilators, which can help with your lung problems and breathing.
Okay.
And then blood
What about the blood tests?
Yeah, so basically we gotta schedule that for another appointment because we can't do this right now because we're just looking over your medical file. So we can probably look over get another test and you'll probably get you an email or a call in later today.
Okay.
And we can see if there's anything that needs to be done, like if your weight levels have changed or increased, and then we could probably figure out medications that you could take.
Okay. I will look into that with the facility. Yeah. Thanks.
Alright, and it seems that you are ready for your flu shot, so we could probably get that in. So when you're taking your test, then probably get that in if you want to.
That will be good. Yeah.
Alright, well that would be all for today, and you're ready to go, and you'll get your call and email later today.
Okay. Thank you. Have a nice day.
You do.